So I'm Amanda Ingram. I'm a drug and alcohol therapist here at Denver Health, and I'm from the STEP program but located in a DPS school at Bruce Randolph, and I get to treat all the kids that go to school here. I have about 35 kids on my caseload at one time. I try to see minimum 5 kids a day for therapy, and we do trauma therapy, not just drug and alcohol therapy. Usually the kids have been traumatized in some way, and that's why they're using substances. This school is in the middle of 5 gang territories, and there's a lot of violence around this neighborhood. And so I'm seeing a lot of post-traumatic stress disorder, a lot of people that have been shot at. I'm seeing a lot of kids who have witnessed domestic violence at home, who have parents that have been deported. That's a lot for a teenager to handle, and they can't emotionally catch up to that. So they end up doing substances so that they can avoid feeling those emotions. And if we work on grief and loss, and we work on trauma, and we work on what they're anxious about and what's causing their depression, what's fueling all of those things, the more they avoid those symptoms, the more they're going to use drugs. The more they talk about it in therapy, the less they feel like they need to use drugs, because they're actually processing all of those experiences that they've had and letting their body kind of discharge those memories. So Luis was referred to me last year for therapy, and we started doing individual therapy. And then the changes really happened when we started family therapy.
Honestly, I think when I started smoking weed, I have an attitude, throw a fit, and I didn't care anymore. I don't know, after that, started changing. I did whatever I want, and didn't care about my grades, had straight A's and everything. At first, when I started coming, I didn't like it that much, and then I got to express my feelings to Miss Amanda. And with Paletta next to me, it gave me more confidence, and I was able to speak my mind. Just holding everything inside of me before, it kills you inside, just not letting things out. Therapy, it changed my whole life. I was able to get closer to my parents, and now I haven't argued with them ever since we had the second family therapy. Haven't argued with them. I stopped smoking weed. I've been sober for a while now, and haven't been in the streets for a while. All I've been focused on is work and school.
What I've noticed is the sickest kids actually recover the quickest. So I have kids with severe post-traumatic stress disorder, severe depression and anxiety. This is the sickest population I've ever worked with, and I've been a therapist for 10 years. And what I'm noticing is the second I start listening to them, and the second they just feel heard and like an adult was trying to understand me, immediately their symptoms start to go from severe to mild. I think probably the most rewarding is getting families in here for family therapy. That's when I see the most amount of improvement.